Patient medical records. Chapter 7. Patient medical records. Patient medical records. Learning objectives. List the components that make up medical records and discuss their importance to the practice, including their role as legal documents. Describe the components of the SOAP format, the most common format used for recording medical information about patients. Identify the three parts of the problem-oriented medical record, POMR, format. Chapter 7. Patient medical records, content. Learning objectives. Transcribe medical data dictated by a physician, while applying guidelines for punctuation, capitalization, and the use of standard medical abbreviations, numbers, and symbols. Discuss the preservation of medical records. Explain who actually owns a patient's medical record. List standards to be used for quality assurance in maintaining medical records. Chapter 7. Key terms: assessment, chief complaint, CC, diagnosis, DX. Family history, FH. History of present illness, HPI. Impression. Objective. Past medical history, PMH. Physical exam, PE. Plan. Problem-oriented medical record, POMR. Review of systems, ROS. Chapter 7. Key terms: content, rule-out, RO, SOAP, social history, SH, subjective. Chapter 7. The medical record patient's chart or patient's file. Information on all aspects of a patient's health care. Vital to medical practice. Continuum of patient care. Financial and legal success of practice. Research purposes. Chapter 7. Legal document. Medical record is the legal record of the medical practice. Used in litigation. Content and the quality of medical record. Should be complete, legible, properly maintained. Chapter 7. Contents of a medical record. Chart notes. History and physical. Referral and consultation letters. Medical reports. Correspondence. Clinical forms. Medication list. Administrative data. Insurance and billing records. Release of information and assignment of benefits. Chapter 7. Why maintain the medical record? Source of information for carrying out patient care. Record of treatment. Record of quality of care. Tool for communication and continuity of care. Legal record for the practice. Record for reimbursement. Data for research purposes. Chapter 7. Maintaining the medical record. An entry is made for each contact with patient. Patient identifying information. Date of contact. Signature and title of provider. Keyed or written in ink. Compact. Entries organized by type and date. Chapter 7. Making corrections. Legal documents. Cross out errors. Do not erase, do not use correction fluid. Cross out errors. Single line, entry should still be legible. Enter the word error next to the cross out. Write your initials and the date. Enter the correct information. Chapter 7. The SOAP method, subjective findings, objective findings, assessment plan. Patient's chief complaint, history of present illness, past medical history, family history, social history, and review of symptoms. Objective findings. Results of physician's exam of patient. Assessment, also called diagnosis or impression. Plan, also called treatment. Includes prescribed medications, patient instructions, recommendations for procedures or tests. Chapter 7. The POM method, problem-oriented medical record, essential components. Database. Complete patient history and information from complete examination and tests. Initial plan. Details of the course of treatment. Problem list. Running list of patient's problems. Recorded in SOAP format. Chapter 7. Transcribing chart notes, other medical documents, and correspondence. Good listening techniques. Format guidelines. Office policy. Abbreviations used carefully. Chapter 7. Records retention and ownership. Time period determined by state law. Move records from active to inactive storage. Guidelines for transferring records should include when to transfer and storage medium to be used. Ownership. Physician's property. Information in record belongs to patient. Patient controls the amount and type of information released. Chapter 7. Quality assurance. Medical record is testament to quality of care given to patient. Helps to maintain high standard of care. Records should contain dated notes describing patient services, notes recording every procedure performed, accurate notations, justification for hospitalization, discharge summaries. Chapter 7. Quiz match the abbreviation with the correct term. CC. ROS. BOM. DX. HPI. P. Problem-oriented medical record. History of present illness. Chief complaint. Review of systems. Physical exam. Diagnosis. Chapter 7.